So you think you might be pregnant? Well, it's a bit of a guessing game until you know for sure. You may feel your body making changes before you know you're pregnant, or you may not notice any changes at all. Well, I'm gonna share with you 6 major early signs of pregnancy that could indicate that you are pregnant. Number 1. Missed period. Missing a period is often the first sign of possible pregnancy. Once conception has happened, your body produces hormones that stop ovulation and the shedding of the lining of your uterus. This means that your menstrual cycle has stopped and you won't have a period again until after having your baby. But missing your period isn't always a sign of pregnancy. You can also miss your period from stress, excessive exercise, dieting, hormone imbalance, and other factors that might cause irregular periods. Number 2. Nausea and vomiting. Morning sickness is a common condition that affects more than half of all pregnant women. The symptoms include nausea, vomiting, and loss of appetite. Despite the name, these pregnancy symptoms can happen at any time of the day or night. Nausea can happen as early as 2 weeks into a pregnancy. Not everyone experiences nausea, and there are various levels of nausea. You can feel nausea but never vomit. About half of pregnant people vomit due to nausea. Though nausea during pregnancy is fairly normal, it can be a problem if you become dehydrated. So contact your healthcare provider if you're experiencing extreme nausea and dehydration. Number 3. Breast changes. During pregnancy, the breast becomes fuller, swollen, and tender. These changes are similar to those that you may have noticed in the few days before your period. During pregnancy, the skin around the nipple becomes darker and the veins in the breast become more obvious. This soreness is temporary and fades once your body gets used to the increased hormones. You may also notice that your breasts have gotten larger and your bra is tighter than normal. Number 4. Fatigue. Many people feel extremely tired in early pregnancy. This sign of pregnancy happens because of high levels of hormone progesterone. Progesterone is needed to maintain the pregnancy and help the baby to grow, but it also slows your metabolism. Similar to other pregnancy symptoms, fatigue tends to get better in the second trimester, that is after week 13 of pregnancy. However, it does come back in the third trimester for many people. Number 5. Frequent urination. Before you even miss a period, you may notice that you have to pee more often. This happens because you have more blood than before. During pregnancy, your body's blood supply increases. Your kidneys filter the blood and remove the extra waste. This waste leaves your body as pee. The more blood in your body, the more you'll have to pee. The swelling of the uterus also presses against the bladder. As a result, most women start experiencing more frequent urination within the first few weeks of becoming pregnant. Number 6. Food cravings and aversions. Food can be complicated during early pregnancy. Some people begin to crave certain foods or feel constantly hungry. While some foods and flavors may seem wonderful in early pregnancy, others may suddenly taste unpleasant. Food aversions can happen throughout pregnancy, making you dislike things you previously enjoyed. Some women even develop an unusual taste for non-food items such as soil or paper. This is called pica, and it can indicate a nutrient deficiency. So please speak to your GP or your midwife if this develops. If you think that you might be pregnant, a good first step is to take a home pregnancy test. Tests are readily available without a prescription in pharmacies and other stores. If you receive a positive result, call a doctor for an appointment. They will perform an examination and a further test to confirm your pregnancy. You can get started on a prenatal program to safeguard your and your fetus's health.